Hello everyone, my name is Bright Ndubeze and this presentation is titled Health in the Headlines, Social Determinants of Health in Nigeria. In this presentation, I will discuss how current events in Nigeria show the powerful effect that social determinants of health have on individuals, families, and communities. I will focus on economic stability, food insecurity, structural inequality, and health inequalities, especially how these issues affect access to food, healthcare, sanitation, and overall well-being. According to the Centers for Disease Control and Prevention, health equity means that every person should have a fair and just opportunity to achieve their best possible health. However, this can be difficult when people face poverty, conflict, hunger, poor sanitation, and limited access to health care services. The first social determinant of health I will discuss is economic stability. A Reuters report from 2025 explained that Nigeria experienced very high inflation in 2024, with inflation rate exceeding 30% before easing slightly in 2025. Food inflation remained a major concern because it increases the cost of basic goods and reduces the purchasing power of many households. This situation has a direct effect on health. When food becomes too expensive, families may not be able to afford nutritious meals. They may begin to eat less food or choose cheaper foods that do not provide enough nutrients. This can increase the risk of malnutrition, especially among children, pregnant women, older adults, and people living in poverty. Economic stability is important because income affects many areas of health, including food choices, housing, transportation, education, and access to medical care. When people are financially stressed, health often becomes harder to protect. The next headline focuses on Nigeria's economic outlook and living conditions. Reuters reported in 2026 that Nigeria's economy was expected to grow, but inflation was still likely to remain a serious concern. Rising fuel prices and economic storms continue to place pressure on household incomes and poverty reduction efforts. Even when a country's economy is projected to grow, many people may still struggle in their daily lives if the cost of food, transportation, medicine, and other basic needs continues to rise. Low-income households are usually affected the most because they spend a larger part of their income on necessities. This creates health challenges because financial strain can limit a person's ability to visit the clinic, buy medications, pay for transportation to a hospital, or afford healthy food. Therefore, economic conditions strongly influence the health and living conditions of individuals and families. Structural determinants. According to Reuters in 2026, more than 17 million people in northern Nigeria were facing acute food insecurity. This crisis was linked to conflict, displacement, economic hardship, and reduced humanitarian funding. This issue shows that hunger is not only caused by individual poverty, it is also shaped by larger structural problems such as insecurity, weak policies, limited funding, and failures in social support system. Crepery and colleagues in their 2021 article explained that structural determinants are the systems, policies, and social conditions that create unequal opportunities for health, In Nigeria, conflict and displacement can prevent people from farming, working, attending school, and accessing health care. When humanitarian support is also limited, families become even more vulnerable to hunger and illness. Structural inequality and malnutrition. The Guardian reported in 2024 that child malnutrition was increasing in northern Nigeria due to rural violence, rising food prices, and displacement. Health facilities were becoming overwhelmed while many children face acute hunger. Children are particularly vulnerable because they need adequate nutrition for growth, learning, and healthy development. When children do not receive enough nutritious food, they may experience poor growth, weakened immunity, and difficulty concentrating in school. This situation reflects structural inequality because children in conflict affected and low income communities often have fewer opportunities to access food, healthcare, clean water, and safe living conditions. These challenges are not equally shared across the population. The health of children should be a major public health priority because improving child nutrition can support healthier families, stronger communities, and better long term outcomes for the country. Health inequities through the example of a cholera outbreak in Borno State. According to Associated Press News in 2026, a cholera outbreak in conflict-affected Borno State caused more than 7,000 infections and multiple deaths. The outbreak was connected to poor sanitation, overcrowded living conditions, and weak health care infrastructure. Cholera is strongly linked to unsafe water and poor sanitation. When communities do not have access to clean water, toilets, waste disposal system, and healthcare services, infectious diseases can spread more easily. This example shows how health inequities develop. People living in overcrowded communities or areas affected by conflict may face greater exposure to disease while also having fewer healthcare resources available. As a result, they may experience worse health outcomes than people living in safer and better resourced areas. Health equity requires addressing these unequal conditions so that every community has access to safe water, sanitation, healthcare, and disease prevention services. To summarize, the headlines discussed in this presentation show that health in Nigeria is strongly influenced by social and structural determinants. First, inflation and poverty reduce people's ability to afford nutritious food and health care. Second, structural factors such as conflict, displacement, weak policies, and funding gaps shape the living conditions of many communities. Finally, health inequities increase the risk of disease outbreaks, malnutrition, and poor health outcomes. Public health action should focus on expanding access to affordable health care, strengthening economic support systems for vulnerable households, improving nutrition programs, and investing in clean water and sanitation services. Addressing both social and structural determinants is essential for achieving health equity in Nigeria. When people have fair access to food, income, safety, sanitation, education, and healthcare, they have a better opportunity to live healthier and productive lives. Thank you for listening to my presentation. The references used in this presentation include reports from Reuters, The Guardian, Associated Press News, the Centers for Disease Control and Prevention, and the article by Crepari and the colleagues. These resources were used to connect current health-related events in Nigeria with broader concepts of social determinants of health, structural inequality, and health equity. Once again, thank you for listening to my presentation. My name still remains Bright Ndoboise from the Department of Health Sciences.